Hi everybody, I am Dr. Sanjay. I'm the plastic surgeon. Now I'm going to talk about today problems in the thigh area for people. Thigh is also a challenging area for people with troubles of fat bulges, saggy skin, cellulites. And in my experience of last 20-25 years, I would have treated about more than 3,000, 4,000 thigh contouring. So what I have done is, based on my experience, I have classified the problems. And it's very important because the treatment is not same for everybody. It is different. Now if you see here, these are different classes. There's one class which is class 1, where overall a person is lean, thin, good weight, but has small pockets of fat around the knee. These are called knee pads. It could be above the knee, it could be on the inner side of the knee, it could be on the outer side of the knee. But as you go beyond that, it falls into class 2, where overall the thigh is a bit bigger, but there are specific bulges. For example, the bulge could be only in the inner thigh, and many people have problems where there's no thigh gap and the thigh rubs. Then in that same class, there's also a category called B, where there are 2 bulges. There'll be a bulge in the inner thigh and bulge in the outer thigh, whereas the knee and the lower part of thigh would be fine. Then yet another division is C, in the same category of 2, where there is fat bulge in the inner thigh, in the outer thigh, along with the knees, inner knees. But overall, the thigh is still not very big or fat. But there is one category, which is class 3, where the thigh is generally big. This is more challenging. Apart from that, there are bulges, additionally bulges in the inner thigh, in the outer thigh, around the knees, and there may be some sagging effect on the skin with cellulites. Then there is another category called class 4, where it's just generally, and you can see generally large thigh, chunky thigh, no bulges, not much cellulite, skin quality is good, but it's just heavy thigh. And then the last category, which is class 5, which is the most challenging, and that's usually because of a lot of fat gain and attempt to lose fat can sometimes lead to a lot of bulges, poor skin quality, sagging, cellulites. So I'm going to discuss about how do we manage these patients, different kinds of patients. Let's have a look at the next slide. Now what we do is, there are 2 different kinds of planning here. One is you do what scientifically we call as topographic planning, where we point out these bulges and you just focus on these bulges. Thigh is not where you just generally do liposuction like in tummy and take out the fat, because what will happen then? The skin will slide and it will give a very unaesthetic appearance to the thigh. So you need to just address into those bulges, prominent bulges, and then just taper it off to aesthetically blend the thigh. And if you see the next image coming up next, here for people who have generally good structure of the thigh, but they do have additional thigh fat, which takes away the muscular definition, particularly in not only in men but also in women who are exercising and doing workouts, but they're not able to chisel the thigh. Now here the planning that we do is called anatomic planning. It's based on the muscles. So we define the muscle, we take out the fat from the areas which needs to be more aesthetically curved, and that gives more chiseled look to the thigh. If we move forward, let's see some examples. Now this is an example of a patient who she's not very big, has some excess fat, but has these bulges in the inner thigh, on the outside of the thighs, in the inner knees. And if you just tackle them, it doesn't change the shape of the thigh completely, but just takes away those unaesthetic bulges. And this is actually long term. It is sustainable. You can see in this particular patient for 2 years. And if you see the next one, another example with slightly more, generally bigger, more body weight, but again, just these bulges. So again here, I've not removed fat from all over the place. I've just focused on these bulges, and you can see how it looks immediately after, and even long term, 8 years later, you will still see it maintained. Obviously, there are a lot of guidance that we need to give to the patient to, eat healthy and keep exercising. Let's see the next. Now this is where the challenges becomes a bit more, where there is generally big thigh, the problems with the skin, cellulite, sagging. Now here liposuction is very challenging and you really need an experienced hand, an experienced eye to just sculpt the thigh without causing additional problems of sagging and cellulites. And if you see next, that's the same patient you see from the side profile. So generally it makes the thigh look smaller, but it doesn't cause additional cellulites and sagging problems. This is from the back, the same patient. Obviously you can't expect to reduce all the fat in the thighs because that would be a disaster. That would lead to a lot of cellulites and loose skin. So you have to be very careful and conservative. Now again, this is again a big challenge where there is a lot of fat, sagging skin, cellulite, and exercise, yes, will help generally reduce size maybe, but it will still add up to the skin, excess skin. There will still be those bulges remaining. So liposuction in a very, conservative way can take away those bulges, reduce that excess fat in those pockets, and yet retain the structure of the thigh without additional problems. So now this is what we saw today in thigh. Next time we'll meet again and we'll talk about calves.